Hello everybody, I am Ahmed Sarwar. I am a third year medical student in the University of Sulaimani of Kurdistan, which you probably has never heard of. So let's try and change that. In this short video, we're going to be talking about some of the commonest types of routes of administration, in which there may be many more other routes of administration, but these are the most common ones. So let's come to the first one, in which it is oral. Oral is usually abbreviated as PO, because PO means per os, in which os is a Latin word that means the mouth, basically wherever you heard of it. Oral medication, oral route of administration can be used to describe any medication that is given orally, which can be a tablet, basically, or it can be a capsule, for example, in most commonly, or maybe it is a liquid. For example, it is a syrup, it is an elixir, or it is a lintas, or suspension, emulsion. Any medication, it can be powder basically, or a pill. Anything that is given via the mouth directly, it is going to be said as PO, and it is going to be given as orally. Another medication or routes of administration that is common is suppository, in which the medication going to be synthetically designed into some sort of hardcover that is, or a hard dosage form that is meant to be introduced via the rectum, the vagina, the urethra, the larynx, the ear, or the nose. The most commonly used suppositories are basically rectal suppository, which is going to be written as PR, means per rectal, or it is vaginal suppository, which is going to be written as VAG, means vaginal. But keep it in mind, all the other ways are still valid. And another thing to keep in mind is that suppository is made of material in which, when it is entering the body's temperature, or when it is getting into the body's temperature, those material will dissolve and they will melt, allowing the actual drug, the actual active substance, to be released into the body. Another thing to keep in mind is about the vaginal delivery and the urethral delivery, because they have specific names for their suppositories, and you need to keep them in mind. For example, vaginal suppositories are usually oval shaped, and they are called pessaries, in which you need to keep in mind. I'm sorry about my pronunciation, but the idea is about the name. And urethral suppositories, whether it is about male urethra or female urethra, doesn't matter. They usually have pencil-like shape, or pencil-like cones, and they are called boogies, which you need to keep in mind the names as well. And the name is pretty interesting to keep in mind because I don't know, I just find it funny, to be honest. And then we have injection, which is the third route of administration that we're going to talk about right now. Injection is a way in which you are directing a drug into the systemic circulation, basically by a syringe, as simple as that. The idea for it is for the drug to immediately reach the systematic circulation, immediately reach the blood, without going through the mouth, without going through the rectum, the skin, or anything, directly into the systematic circulation. Obviously, the drug will have a much more rapid onset and compared to the other routes of administration. And it is very useful in patients that are unable to take oral medication. Maybe the patient is unconscious. How on earth will we give them an oral medication if they are unconscious? Or maybe it is used for drugs that are poorly absorbed from the GIT. Maybe you are talking about something like heparin. Or it is unstable in the GIT. It is destroyed by gastric acidity. For example, you are talking about something like insulin. Or maybe the drug undergo extensive first pass metabolism. Because if you give a drug orally, the drug will get into the stomach, it will get into the GIT, absorb, enter the portal circulation, into the liver, then it is coming back via the systematic circulation and into the actual blood that we needed. So if a drug has an extensive first pass metabolism, it is extensively metabolized when it is passing via the portal circulation into the liver, then very little amount of the drug will be reaching our actual body. Something like that is like nitroglycerin or lots of other medication. That's why we need to have injection. And injection is providing us the most amount of control over any drug that is reaching the body. But the another idea about injection that you need to keep in mind, because all things I said was beneficial, is that injection is irreversible. You cannot make the person vomit and get over with it. When you give the drug, you give the drug. There is no coming back. So it is more likely to cause, for example, pain, infection, damage to the local tissue, or even it is causing fear and infection because the syringe may be contaminated, especially if it is in a maybe emergency situation. You didn't look into that. If the syringe is contaminated by some virus or something like that, when you put it in a healthy patient, they would immediately get the disease because the virus will be coming into the actual blood. But injection, in long story short, can be classified into lots of types. For example, we have IV, in which it is intravenous. The drug is administration into the venous circulation. This one has the most rapid effect. Or it can be subcutaneously, SC or SQ, in which the drug is administered into the subcutaneous space. It can also be ID, means intradermal, in which the drug is administration into the dermis. Or maybe it is intramuscular, via the muscle. The drug is administered into the muscle. These three have sustained effect. They are providing us with depot form. Basically, you administer the drug, it will be stored and released very slowly into the blood, which is beneficial. It can also be epidural, in which the drug is administered into the epidural space, or it is intrathecal. It is the drug is being administered into the subarachnoid space, which can be beneficial in certain areas. Now let's come to the fourth one, in which it is transdermal. This one, the drug is administered to the systematic circulation by applying it to our skin, usually via a transdermal patch. And you're just gonna put it on the skin. This has one of the most sustained effects that a drug can ever have, because when you give the drug transdermally, it will actually be stored in our it will actually be stored in our muscles, and then it will be released very slowly. It is often dosed once a day, meaning that it is dosed once every 24 hours, once per day. It is often in certain cases. For example, it can be used for angina, an MI patient using nitroglycerin, or it can be used as nicotine patch, which is one of the most common transdermal patches that is being used in order to help smokers to facilitate their cessations of smoking. Instead of smoking, for example, 30 cigarettes a day, they use a simple patch daily, get the same amount of nicotine, and piece by piece, day by day, they will slowly decrease the nicotine in the transdermal patch, and hopefully they will stop smoking. It can also be used as scopolamine as an antiemetic agent. Now let's come to the fifth one, inhalation. Inhalation can be basically oral inhalation or nasal inhalation. This can have systematic effect or local effect. It all depends on the dose. If you give low dose, it honestly have local effect, but if you give high dose, it will have systematic effect. So let's talk about oral inhalations. Oral inhalation, when it is administered to the patient, will have a very rapid delivery of the drug, almost as fast as IV, into a large surface area of the entire mucous membrane of the respiratory tract and the pulmonary epithelium. They are very useful in the treatment of asthma and COPD because they are localized in their action unless we give high dose, which they will have systematic effect. It can be something like adrenergic agonists, such as albuterol, or it can be corticosteroids, such as fluticasone. What about nasal inhalation? You directly administer the drug into the nose via inhaling it through the nose. It can be used in various medications, for example, nasal decongestion, as oxymetazoline. Like I said, localized effect unless we give very high dose. Now let's come to topical. Topical is basically localized effect. Is when a drug or a medication is being applied to the skin. The most common three types of topical is basically cream, and then we have lotion. Also, we have ointment. So what is the difference between them? All of these agents are composed of a different degree or percentage of combination of water and oil, in which ointment is mostly composed of oil, meaning it is very greasy, so it is very hard to spread this. And another idea about ointment is that it is poorly absorbed. It is very slowly absorbed. It is protecting us against loss of moisturization. This is obviously used in dry skin. Then we have cream. Cream is water-based agent. It is mostly composed of water, less greasy, more easily spreadable, more easily absorbed, used with oily skin or oily mucous membrane. Now we have lotion. Lotion is also composed of water. It has even more water than cream. So water content of lotion is much more than water content inside the cream. And lotion, it is sometimes containing alcohol, what is very easily absorbed, leaving very little residual behind. It is usually used in areas that has hair. For example, on the face or something like that, in which someone have a beard, the lotion would be much more easier to use than the cream. Now let's come to sublingual and buccal. These two mechanisms are very alike to each other, but they are used alternatively with each other. Basically, the sublingual idea is you put the medication between the tongue and the floor of the nose. That's the whole idea. You put it below, sub means below, lingual means tongue, you put the medication below the tongue. In buccal, we are basically putting the medication between the gum and between the cheek. Both of these are bypassing first pass metabolism, meaning that they do not have the problem with PO. They do not have the problem with oral route of administration. They are bypassing first pass metabolism. They are immediately reaching the drug. But here is their differences. Sublingual is much rapid, or it is much faster in their mechanism of action in compared to buccal. Another thing is that the sublingual space, if you just think about it, is a bit smaller than the buccal space. So sublingual route of administration, or when you are giving medication sublingually, the dose is usually smaller in compared to the buccal. The most common drug that is given sublingually particularly is nitroglycerin, which is used for anginal chest pain. And that's all about this video that we want to talk about. Basically, thank you very much for watching us, and tell us any comment, maybe opinion, suggestion about how we can improve. We are really open to that idea because we are really new to this, and we'd be very glad to your opinion about it. And tell us what do you like us to talk about in the future videos about any field of medicine. Please don't forget to like and subscribe. Once again, thank you very much for watching and keep learning.